Hello, this is Professor Capron. Welcome to this presentation on premature atrial contractions. Let's take a look at the learning objectives for this presentation. By the end of this presentation, you should be able to identify the key ECG characteristics of premature atrial contractions, understand the physiological mechanism behind PACs, assess the clinical presentation and implications of PACs, and manage PACs through appropriate medical and nursing interventions, as well as recognize related conditions and triggers of PACs. There's just a few key terms for this presentation, but please make sure that you know them. If you're struggling with these even after the presentation, please come and find me in class. So let's take a look at the ECG characteristics of premature atrial contractions, or PACs. In PACs, you'll notice that the rhythm is irregular. This irregularity is caused by premature beats originating from an ectopic focus in the atria. These early beats disrupt the regular rhythm established by the sinoatrial node. The irregularity can be subtle or quite pronounced, depending on the frequency of the PACs. Frequent PACs can make the rhythm appear very erratic. Normally, each QRS complex is preceded by a P wave, indicating that the atrial contraction leads to ventricular contraction. In PACs, the P wave is still present before the QRS complex, but it may look different. This is because the premature beat originates from an abnormal ectopic focus in the atria rather than the SA node. The P wave may be taller, shorter, or have a different shape altogether compared to the P waves that originate from the SA node. This difference helps in identifying PACs on the ECG. The PR interval is the time from the onset of the P wave to the start of the QRS complex, normally ranging from 0.12 to 0.2 seconds. In PACs, even though the P wave may look different, the PR interval typically remains within this normal range. This is because the impulse still travels through the normal conduction pathway. It just starts earlier than usual. The QRS duration measures the time it takes for ventricular depolarization and normally ranges from 0.06 to 0.12 seconds. In the case of PACs, the QRS duration usually remains normal because the premature atrial impulse still follows the regular conduction pathway through the ventricles. However, if there is an underlying bundle branch block, the QRS duration may be prolonged. This is important to note because it can complicate the interpretation of the ECG. Let's look at the physiology that causes PACs. PACs are caused by an ectopic focus in the atria. An ectopic focus is an abnormal group of cells that initiates an electrical impulse independently of the sinoatrial node. Normally, the SA node is the heart's primary pacemaker, generating impulses that regulate the heartbeat. However, in PACs, the ectopic focus in the atria takes over momentarily, leading to premature beats. This ectopic focus can be anywhere in the atria, and its activity can disrupt the normal rhythm set by the SA node. The ectopic focus generates an electrical impulse earlier than the next expected impulse from the SA node. This early impulse causes the atria to depolarize prematurely. Remember, depolarization is the process by which cardiac muscle cells become electrically activated, leading to contraction. In PACs, this premature depolarization occurs before the SA node can initiate its regular impulse. The result is an early contraction of the atria, which is seen as a premature P wave on the ECG. This P wave may have a different morphology compared to normal P waves due to the different origin of the impulse. These can be caused by things like stress, caffeine, or electrolyte imbalances. Emotional or physical stress can increase the activity of the sympathetic nervous system, which in turn can increase the likelihood of ectopic foci firing in the atria. This heightened state of arousal can lead to PACs. Caffeine is a stimulant that can increase heart rate and enhance the excitability of cardiac cells. It lowers the threshold for depolarization, making it easier for ectopic foci to trigger premature beats. High consumption of caffeinated beverages like coffee, tea, or energy drinks is a common trigger for PACs. Electrolytes like potassium, calcium, and magnesium play crucial roles in the electrical activity of the heart. Imbalances in these electrolytes can disrupt normal cardiac function and promote the development of ectopic foci. For instance, low potassium levels, hypokalemia, can increase the risk of PACs by affecting the stability of the cardiac cell membrane. Let's talk about assessment of PACs. Patients with PACs often report a sensation of fluttering or an abnormal awareness of their heartbeat known as palpitations. This fluttering is due to the premature contractions that disrupt the normal rhythm of the heart. Patients may describe it as feeling like their heart skipped a beat or jumped. While PACs can be benign and are often asymptomatic, the sensation can cause anxiety or discomfort in some patients. Typically, PACs do not significantly affect hemodynamic stability. Most patients with occasional PACs remain hemodynamically stable, meaning their blood pressure, heart rate, and overall cardiovascular function remain within normal ranges. However, if PACs are frequent or occur in rapid succession, they can lead to symptoms such as dizziness, lightheadedness, or a general sense of discomfort. This is because frequent PACs can interfere with the heart's ability to pump blood efficiently. In patients with underlying heart conditions or structural heart disease, frequent PACs may exacerbate their symptoms or indicate a higher risk of developing more serious arrhythmias. ECG monitoring is essential for diagnosing and assessing PACs. A routine 12-lead ECG can provide a snapshot of the heart's electrical activity, helping to identify PACs and assess their characteristics. For more frequent or symptomatic PACs, continuous ECG monitoring, such as with a Holter monitor or an event recorder, may be necessary. These devices record the heart's electrical activity over a prolonged period, typically 24 to 48 hours or longer if needed. Continuous monitoring helps detect the frequency and pattern of PACs, which can vary throughout the day and in response to different activities or triggers. On the ECG, PACs are identified by the presence of premature P waves that may have a different morphology compared to normal P waves, followed by a normal QRS complex. The rhythm will appear irregular due to these premature beats. It's important to document the occurrence of PACs, noting their frequency and any associated symptoms to guide management and treatment decisions. PACs are common and often do not cause significant health issues. Many individuals experience PACs without any noticeable symptoms or adverse effects. In most cases, especially if PACs are infrequent and asymptomatic, no specific medical treatment is necessary. Patients can be reassured that occasional PACs are generally harmless. For patients who experience frequent PACs or who find them bothersome, medical intervention may be considered. Beta blockers such as metoprolol or atenolol can be prescribed to help reduce the frequency of PACs and alleviate symptoms like palpitations. These medications work by slowing the heart rate and reducing the excitability of the heart muscle. The decision to use beta blockers will depend on the patient's overall health, the severity of symptoms, and any underlying conditions. It is important to weigh the benefits of symptom relief against potential side effects of beta blockers, such as fatigue, dizziness, or bradycardia. Identifying and addressing underlying triggers or contributing factors is crucial in managing PACs. Electrolyte imbalances, particularly involving potassium, magnesium, or calcium levels, can increase the likelihood of PACs. Blood tests can help to identify these imbalances. Correcting them through dietary changes or supplementation can reduce the occurrence of PACs. For example, increasing dietary intake of potassium-rich foods or using magnesium supplements may be beneficial. Stress and anxiety are common triggers for PACs. Patients may benefit from stress reduction techniques such as mindfulness, meditation, or relaxation exercises. Behavioral therapy, such as cognitive behavioral therapy or CBT, can also be effective in managing anxiety that may contribute to PACs. Caffeine and other stimulants, such as nicotine or certain medications, can precipitate PACs. Reducing or eliminating caffeine intake and avoiding stimulants can help to decrease the frequency of PACs. Encouraging a healthy lifestyle, including regular exercise, adequate sleep, and a balanced diet, can improve overall cardiovascular health and reduce the incidence of PACs. Avoiding excessive alcohol consumption and stopping smoking are also important lifestyle changes that can positively impact heart rhythms. Now let's look at the nursing management of PACs. The first step in managing PACs is to identify potential triggers that may be causing or exacerbating the condition. Common triggers include caffeine, stress, alcohol, tobacco, and certain medications. Caffeine is a well-known stimulant that can increase the frequencies of PACs. Patients should be advised to limit or eliminate caffeine intake from sources such as coffee, tea, energy drinks, and certain medications. Stress is another significant trigger for PACs. Encourage patients to adopt stress reduction techniques such as mindfulness, yoga, meditation, deep breathing exercises, or engaging in hobbies and activities that they find relaxing. Advise patients to reduce or eliminate alcohol consumption and quit smoking, as both can increase the likelihood of PACs, and review the patient's current medications and identify any that may contribute to PACs. Consult with the prescribing healthcare provider to discuss possible alternatives or adjustments. Regular or continuous ECG monitoring, like using a Holter, helps to document the occurrence of PACs and assess their pattern. This is crucial in determining the effectiveness of interventions and any necessary adjustments to treatment. For patients who are experiencing frequent PACs, a Holter monitor can provide a 24-hour or longer continuous recording of the heart's electrical activity. This helps in correlating symptoms with PACs and identifying periods of increased occurrence. Encourage patients to keep a symptom diary, noting the occurrence of palpitations or fluttering sensations, along with possible triggers or activities that precede those. This can provide valuable information for both the patient and the healthcare team. Patient education is a critical component of managing PACs. Educate patients on lifestyle changes that can help to reduce the occurrence of PACs. Advise patients to adopt a heart-healthy diet rich in fruits, vegetables, whole grains, lean proteins, and low in processed foods, sugar, and unhealthy fats. Reducing caffeine and alcohol intake is also important. Encourage regular physical activity such as walking, swimming, or cycling, which can improve overall cardiovascular health and help to reduce stress. However, patients should avoid excessive exercise that may trigger PACs. Ensure that patients maintain adequate hydration, as dehydration can contribute to electrolyte imbalances and PACs. Emphasize the importance of good sleep hygiene. Adequate and quality sleep is essential for reducing stress and maintaining overall health. Teach patients various stress management techniques and encourage them to incorporate these into their daily routines to help mitigate one of the common triggers of PACs. Now let's discuss how patients with premature atrial contractions typically present. When assessing patients with PACs, it's crucial to monitor their heart rate. PACs may cause occasional irregularities in the pulse, but overall, the heart rate should generally fall within the normal range. If the PACs are frequent, they can lead to noticeable fluctuations in heart rate. Therefore, it's essential to document any irregularities and assess if they correlate with the patient's symptoms. Regular monitoring of blood pressure is necessary because significant fluctuations in heart rate due to PACs can sometimes affect blood pressure. While most patients with PACs maintain a normal blood pressure, some might experience transient drops or elevations, especially if the PACs are frequent or symptomatic. The most common symptom reported by patients with PACs is palpitations. Patients often describe palpitations as a feeling of the heart skipping a beat or a fluttering sensation in the chest. It's important to ask patients to describe their palpitations in detail, including the frequency, duration, and any associated activities or triggers. The sensation can feel like a rapid, irregular heartbeat and may come and go suddenly, is often felt in the chest or throat. This fluttering sensation is due to the premature contraction of the atria, which can be more noticeable in some patients, particularly those who are more attuned to their heart rhythms. Some patients may experience dizziness, especially if the PACs are frequent and disrupt the normal heart rhythm enough to affect cardiac output temporarily. Assessing for dizziness involves asking about the frequency and severity of these episodes and determining if they are associated with specific activities or times of day. Many patients with PACs maintain normal activity levels without significant limitations. They can perform daily activities, exercise, and engage in regular routines without much difficulty. However, it's important to encourage patients to stay active while being mindful of any symptoms that may arise during physical exertion. Some patients might report discomfort during episodes of PACs, particularly during physical activity or stress. This discomfort can range from mild annoyance to significant discomfort affecting their quality of life. It's essential to reassure patients that while PACs can be uncomfortable, they are generally benign. However, persistent symptoms warrant further evaluation to rule out more serious underlying conditions. Let's explore some conditions related to premature atrial contractions and their significance. Stress is one of the most common triggers for PACs. When the body is under stress, it releases hormones like adrenaline, which can increase heart rate and irritate the electrical system of the heart, leading to premature contractions. Patients experiencing high levels of stress may report an increase in palpitations and episodes of PACs. This can be due to both acute stress, such as an anxiety attack, or chronic stress, which is ongoing worry or pressure. It's important to address stress management in patients with frequent PACs. Techniques such as relaxation exercises, mindfulness, yoga, or counseling can be beneficial. Encourage patients to identify and reduce stressors in their life. Providing resources for stress management can significantly reduce the frequencies of PACs. Caffeine is a known stimulant that can increase the frequency of PACs. It acts on the central nervous system and can increase heart rate and irritate the heart's electrical system. Common sources of caffeine include coffee, tea, energy drinks, and certain medications. Educate patients on the potential impact of caffeine on their heart rhythm. Advise them to monitor their caffeine intake and reduce it if they notice an increase in PACs. Suggest alternatives to caffeinated beverages such as herbal teas or decaffeinated options to help manage and potentially reduce PAC episodes. Electrolytes like potassium, calcium, and magnesium play a crucial role in maintaining the heart's electrical stability. Imbalances in these electrolytes can disrupt normal cardiac conduction. Regular monitoring of electrolyte levels is important, especially in patients with a history of PACs. This includes checking blood levels of potassium, magnesium, and calcium. Correcting electrolyte imbalances involves dietary adjustments, supplements, or medication changes. Educate patients on the importance of a balanced diet rich in essential electrolytes. Patients with underlying heart conditions such as coronary artery disease, cardiomyopathy, or heart failure are more prone to PACs. The structural and functional changes in the heart associated with these diseases can lead to increased atrial irritability. PACs in patients with heart disease may indicate a worsening of the underlying condition and necessitate further evaluation. So, in patients with heart disease, frequent PACs can be a marker for increased risk of more serious arrhythmias and may require more intensive monitoring and management. It's important to manage the underlying heart disease aggressively to reduce the occurrence of PACs. This includes optimizing medical therapy, lifestyle modifications, and regular follow up with a cardiologist. Let's summarize the key points related to premature atrial contractions. First of all, you learned how to identify them on an ECG due to their characteristic irregular rhythm because of the premature atrial beats. There will be a P wave before each QRS complex. The P wave may look different from the sinus P waves because it originates from an ectopic focus in the atria. The PR interval remains within normal limits, and the QRS duration is also normal unless there is an underlying bundle branch block. The key to identifying PACs is recognizing the early, abnormal P wave that is followed by a QRS complex. You learned that PACs occur due to an ectopic focus in the atria, meaning that an area outside the SA node is firing early, and that this focus triggers an early atrial depolarization, resulting in a premature beat. You learn that in most cases they are benign and do not require specific treatment. They're often found incidentally on an ECG or when patients report palpitations, but frequent PACs can be uncomfortable and may cause symptoms such as a fluttering sensation, palpitations, or occasional dizziness. While PACs are generally harmless, it's important to assess the overall frequency and any associated symptoms to determine if further management is necessary. You learned that identifying and reducing triggers is a key management strategy for PACs. Common triggers include caffeine, stress, alcohol, and certain medications, and that educating patients on lifestyle modifications to reduce these triggers can help to decrease the frequencies of PACs. We recognize that regular monitoring of PACs is important, especially if the patient experiences symptoms. Patients should be advised to report any significant changes in their symptoms or the frequency of their PACs to their provider to help with any early detection of potential complications or underlying conditions. If PACs are frequent and symptomatic, beta blockers might be prescribed to help reduce the frequency and severity of the symptoms. These medications work by decreasing the excitability of the atrial cells and stabilizing the heart rate. Thank you so much for paying attention to this presentation. If you have any questions, you can see me in class. Otherwise, go on, get out of here, go do some nursey things.